Good afternoon, everybody. Doc Dave here. So today we're going to do episode number 22 on a condition called diverticulitis. Now, this is a little more common than you think. I've seen a lot of people in the emergency room presenting with diverticulitis that had, either never had it before or had no idea, what it was or what caused it or how it's going to be treated. So I'm going to try to cover those issues today. So let me explain to you a little bit what it is. Normally, your large intestines, usually in the sigmoid area, which is the descending colon, that goes into the sigmoid colon, which goes into the rectum. So it's way down, generally low, and it's usually on the lower left side of your abdomen. And a lot of times you're going to develop things called diverticulosis. If you ever have colonoscopies, the doctor says, well, you got diverticulosis, but, it's generally pretty benign. And what it is due to, like low fiber diets and you kind of get constipated a lot, the pressure in your colon goes up and it causes the bowel wall to herniate. And you get little hernias, little pouches in the bowel wall. And the majority of the time, they're painless. Sometimes they can cause some bright red bleeding in your stools, which is pretty dramatic. But it's usually painless. You don't have a fever with it. It's usually one of the pouches, gets into one of the little capillaries or small arteries and it ruptures and you pass a large volume of blood in your stools. It's generally more dramatic than it is anything serious. But that's diverticulosis, the little pouches in the wall of your colon, which almost all of us have by the time we're maybe 70. So what causes diverticulitis then? Well, the definition of diverticulitis is it's technically an inflammation with an infection in the pouches of the large bowel in that sigmoid colon. So something triggers an inflammation in one of those little pouches, and then bacteria gets in there. There's a lot of E. coli in your stool, obviously, and that gets kind of trapped in those pouches, and then the pouches become inflamed like a boil on your skin. And the problem with that is, if you don't take care of it right away, that pouch will continue to expand and it may develop an abscess, just like you would on a boil on your skin, like I mentioned. So try to think of that as, a relationship to what's going on in your bowel wall at the time. Now, the problem with that abscess is it can spontaneously rupture. And if that ruptures, then you got a major problem because now you're going to be spilling purulent material into your abdominal cavity called peritonitis. And that can cause all kinds of havoc and it could even be deadly. So you kind of got to take this serious. It's kind of like an engine light going on. Well, you don't want to ignore it too long. You start getting that pain down there, especially if you develop a fever, then you got to go to the ER pronto. So, what kind of turns the diverticulosis into a diverticulitis? Well, they don't really have a great answer for that in all the research I've done, but basically it's secondary to not eating enough fiber, because fiber causes your stools to be soft. It doesn't increase the pressure in your walls of your large bowel. And, and so you don't get as many, if any, of those little pouches, which will develop into an inflamed diverticulitis. So fiber is really important. Now, what triggers that, though? What turns the pouch into an infection? Well, usually it's dietary, processed meats, red meats, fried foods will cause those, as they go through the digestive tract, will cause those little pouches to get inflamed, and now you got a diverticulitis. So what kind of foods do you avoid then? Well, just what I mentioned, plus whole grains. You don't want anything with any seeds or beans. You don't want any nuts or any popcorn or any coffee, believe it or not, because coffee is a stimulant in the large bowel, and it could cause a pouch that's somewhat fragile to rupture and cause an abscess. So if you're having diverticulitis symptoms, you don't want a cup of coffee, and you don't want any of this other stuff I just mentioned. So how do you self-treat it? Can you self-treat it, or you got to go to the ER right away? Well, self-treatment would generally be go on a clear food and a clear liquid diet. And that way 3 days, 4 days, that might cool it down so that the inflammation doesn't become an infection. Okay? A lot of things can be inflamed, but they don't always get infected. So chicken, beef, or veggie broth is really good. Fruit juices with no pulp is okay. And Metamucil to keep your stool soft, and probiotics. So that's kind of what you can do at home. Don't be taking any non-steroidals. Don't be taking blood thinners at that point. If you're taking blood thinners, let your doctor know. Contact him first. Don't just stop him by yourself. Discuss it with him, and he'll determine the pros and cons, whether you stay on them or whether you can get off them for a few days. So, what would make you go to the ER? What involves medical treatment now, not just self-treatment? Okay, now that you know what diverticulitis is, what makes you go to the ER? Well, specifically if you have a fever or chills, that's a warning sign. Got to react to that. You got to be active and get to the ER, or go to your doctor, or at least call your doctor and, communicate with him. But if you got a fever, got to go to the ER. And also increasing pain. So say you get the diverticulosis, which is painless, and then all of a sudden you get a little inflammation in one of those pouches, and the pain goes from, a 0 to maybe a 3 or a 4. That's not a terrible concern. But if the pain jumps up to an 8 or 9, boom, you got to get to the ER right away, because you don't want that pouch, which may be developing an abscess, to rupture. Okay, so what do? You get to the ER. Okay, they're going to bring you in. They're going to start an IV, draw some blood tests, get some blood cultures, and give you some pain management. That's what you got to get. That's what you're going for. And then the most important thing is they'll do a CT scan to diagnose it, and they'll put you on proper antibiotics. And so you're going to be in the hospital for 3 or 4 days. So just get used to it. Accept the fact this is, has a lot of potential bad side effects to it. So you don't want that to progress to those side effects. So IV antibiotics, IV hydration, IV pain management. Then they'll start you on a little bit of a diet after 3 days. When the fever goes away, the white count kind of comes back down to normal. You're not having any symptoms of an abscess or a ruptured abscess in your abdominal cavity. So they start you back again. Listen for bowel sounds. Once you have a bowel movement, you can eat okay. You got bowel sounds. You're doing all right. Boom, you go home. You finish the antibiotics in the oral form for probably another 10 days to 2 weeks. So that's pretty much diverticulitis in a nutshell. It's everything you need to know. I'm not going to complicate it. I'm not going to go over the names of the antibiotics. You always got to, communicate with your private doctor, and if you can't get a hold of them or you're concerned, just go to the emergency room. They'll take care of you there, and they'll notify your doctor for you. So, you like this? I liked it. I enjoyed reviewing it. I've seen it a lot, and I knew pretty much all this stuff, but you learn something every day, right? So that's what this whole podcast is about, for you to learn something every day. Not me, but for you. And so hit the like button if you like it, hit the subscribe button, pass it on to your elderly, family members or friends, and say, hey, if you ever get this, keep an eye on it. And I'll talk to you next time about another educational medical condition. Thank you for your time.